Okay, welcome back, folks. We are going to take one final look at, I gotta make sure I got the right number, H 534, strike all amendment. And Katie's going to pull it up on the screen, and it eventually will be posted on our webpage momentarily. So Katie, just kind of briefly run through it.
Sure. So essentially this draft 2.1 is essentially the same amendment you just looked at in a different format. So now we're striking out the whole bill and putting it in again. And you'll see that the first three sections, statutory sections in Sec 1, are identical to the bill as introduced. So 3901, 3902, and 3903. Those are all pulled from the bill as introduced. No changes there. The changes that we looked at earlier today are in 3904 and 3905. So 3904, this is where we have the Community Action Agency Assessment and Plan. Each designated community action agency shall determine the need for activities and services within the area served by the agency every 3 years, complete an assessment, and incorporate that information into an annual community action plan. The plan shall include a schedule for the anticipated provision of new or ongoing services and shall specify the resources that are needed by and available to the agency to implement the plan. 3905, again, these are the changes that we looked at earlier today, community action agencies. On line 2, we're referring to the plan instead of the community services plan, the community action plan, to be consistent with the previous section. In subsection B, the leave-in language is the same from the bill as introduced, but the subdivisions have changed around. So you've moved what is currently subdivision 1 down to subdivision 2. That's why subdivision 2 is underlined. It's not new language, but it's in a new place. The current subdivision 2 would become subdivision 1, and you're adding the language at the beginning of it, a minimum of 1/3 of the members of the board. And then in subsection C, same changes as the bill is introduced, effective July 1, 2026.
Thank you, Katie. So are there any questions or clarifications needed before we move to a vote on the bill? Okay, so I would entertain a motion to approve version 5, H. Let me start this over again, okay? I would entertain a motion to approve version 2.1 of H 534 pending any potential technical edits by drafting ops. Is there such a motion?
I'll make a motion.
Okay, thank you. All right, is there any further discussion? Okay, clerk, please call the roll.
Representative Bishop,
Yes.
Representative Cole,
Yes.
Representative Donahue, Representative Easties,
Yes.
Representative Garfano,
Yes.
Representative McGuire,
Yes.
Representative McGill,
Yes.
Representative Nielsen,
Yes.
Representative Noyes, yes. Representative Steady,
Yes.
Representative Wood.
Yes.
Excellent.
And Representative Noyes will be reporting this on the floor.
10-0-1. Great.
Okay, great. Okay, so I'm just wondering if we should be moving ahead, Katie, on 5:45 while you're here.
Sure.
Okay, since people just had a break.
Yep. I'm just sending this to the editor so you can move this along.
Okay. And version 2.1 was posted, 5:45 was posted on our, I should look and see if it's there today, but it was definitely there yesterday. Pardon me?
I was waiting to see if there was a new one. So do you want to repost yesterday's?
Sure. So when we get to 5:45, you will, Lori's going to repost it on today, but you can look on it yesterday if you want. You'll see that the length of the bill has substantially increased, and that is to accommodate a sunset of the bill as introduced. And what essentially that means is that another legislature 6 years from now will need to take up the topic again, see what is happening at that point in time, and they'll be voting on whether to continue what we've done here or whether to revert back or make any further changes. So that's all that sunset means. But it means that there will need to be further action. And whenever you're ready, Katie, you can pull this up on the screen too.
Okay. Sorry, I'm still.
No, that's all right. Keep going.
So,
You good?
Okay. Oh, I'm gonna switch folders.
Who's the IT person? Is it Scott Moore?
Keep staying.
Yeah.
Wait, what do you?
Who's the ledge council that does the IT?
Eric.
one.
Eric, I don't know what Eric's last name is.
Fitzpatrick? Eric from,
No, Eric down in,
Oh, sorry.
is that person? Oh, no, sorry, wrong one.
That's all right. I'll track it down.
Okay.
It's Moore's last name, but
yeah.
Kevin.
The head of
Kevin.
IT, Kevin, yeah.
that's it. It's always asking for phishing scam emails. Good.
So I have 2.1 pulled up. Folks are,
Yeah, no, we're ready. Go for it.
thank you for waiting. So just to sort of ground you where we are, language that's highlighted in yellow is language you haven't seen yet before. As you will notice, the page length is much higher than last time you looked at it. Don't let that be too intimidating. Basically, what is happening here is because you're requesting a 6-year sunset of this language. There's no automatic way to just go back to where we are right now. Basically, we have to remove the proposed amendments and reactivate the language that's being struck through. So that's why it's being, the language is being shown twice. You're showing language to go back to where you are now after 6 years. So that is what all the yellow highlighting is in the second half of the draft. I've tried to add some reading headers to sort of make it a little clearer where we are in time and in the bill. So hopefully that helps. I noticed there's one place where I haven't done that, so I'll add that in. Okay, so first we're looking at the immunization recommendations that are in effect on passage through July 1, 2031. So this language you've already looked at, and the yellow is language that represents changes that were requested. So as you remember, the term immunizations is being replaced with recommended immunization. And there is a suggestion from the health department to the language means a vaccine or other immunizing agent that provides protection against a particular disease or pathogen. And the application of the immunization is recommended by the practice guidelines for children and adults established by the commissioner pursuant to 1130A of this title. So I think that's language that they discussed with you about why the use of immunization versus vaccine. Next at the top of page 2, I'm trying to be more consistent of striking of health after the department or the commissioner because those terms are defined for the title and they don't need to be replicated each time. So that's why that is struck through there. And when we last spoke, there was a lot of conversation about who on line 3, who is the population that this program is serving. There were various iterations that were discussed, and at the end, the committee decided just to be silent on that point. So the language would read, the goals of ensuring universal access recommended vaccinate, sorry. The goals of ensuring universal access to recommended immunizations at no charge to the individual. So just omitting that specific language. Next change in subsection C, the department is to determine which recommended immunizations shall be purchased under the program. The program shall purchase recommended immunizations consistent with the goals of the program from the CDC or another vendor at the lowest available cost. So there was an interest in not just letting the language about the lowest available cost sit by itself, but be paired with consistent with the goals of the program. Skipping down to subsection G, which is the,
Before you go there,
please.
just on it, does that, there, we had committee discussion about that, because we didn't want lowest cost to be the only determining factor. And I'm just checking in with people to see if that language meets the intent of what people had questions about. I'm seeing head nods.
Yes.
Okay, thank you.
okay,
And I just will say that if we get to a piece of language that has changed, that's based on the discussions that we had, and you want to have further discussion, now's the time to bring that up, okay? So for further changes, just, I realized I wasn't clear about that at the beginning.
okay, subsection G, this is the funding advisory committee. On 17, I struck out of health again to be, so we're not sort of sporadic if when we're commissioner of health or commissioner, and it's already a defined term. Then we have the membership of this advisory committee. So on line 3 of page 4, the executive officer of the Board of Pharmacy or designate. Subdivision D, the executive director of the Green Mountain Care Board or designee. Subdivision C, a representative appointed by the director of the Vermont Blueprint for Health. And you've removed the language about nominated by the director and appointed by the commissioner. Subdivision D, 3 representatives of health insurers, 1 each appointed by the state's largest 3 private health insurers as determined by the number of covered lives. Subdivision E, a representative appointed by the Vermont chapter of the Academy of Pediatrics. Subdivision F, a representative appointed by the Vermont chapter of the American Academy of Family Medicine. No changes in subdivision G.
Okay, so just before we move there, after you left yesterday, the committee concurred with the Office of Professional Regulations request for an amendment to include a member from the APRN group, as well as the a pharmacist.
Is that for the funding or for the?
Oh, I'm sorry for the next
Okay.
one. Sorry.
Nope, that's okay. It's
Sorry.
confusing to have 2.
No,
in one bill.
Sorry. I was thinking, like, I don't want to miss it. I don't want to miss it.
No, let it.
I'm ahead of it. Yeah, okay, all right. Thank you.
You're still winning.
Yeah.
Okay, that brings us to page 5 on line 3. I've struck through of health, so we're just using the department. Let's see. I don't think there are any other changes in that section. So that's it for new changes in section 1. Section 2, this is our language of all, our section of all new language. So this will be sunset on July 1, 2031. Last time we met, the committee was interested in emphasizing the language about recommendations and wanted to add recommended to all of the duties of the commissioner. So it now reads that the commissioner shall periodically issue recommendations regarding which immunizations children and adults are recommended to receive, the age at which each immunization is recommended to be given, the number of immunization doses that are recommended to be administered, the recommended amount of time between doses of an immunization, and any other recommendations regarding immunizations necessary to promote instead of ensure the maintenance of public health and disease prevention in the state. No changes in subsection B, which was who the commissioner is consulting with, which recommendations are being considered. subsection C, that was the immunity language, no changes there. Subsection B, this is the standing order. You didn't make any changes to the standing order section. Subsection E is a new subsection. First, that the department shall prominently display information pertaining to recommended immunizations and other relevant information on its website, including how to access recommended immunizations. Second, any documents produced by the department about the recommended immunization shall include a disclosure if the recommended immunizations differ from the recommendations of the Vermont Immunization Advisory Council. And then we're just re-lettering subsection F.
So just before we go there, is there any comments, questions, or clarifications needed about section E, numbers 1 and 2? Those were additions that we made based upon our conversations and deliberations here.
Very, very picky. Sorry, but and I'll defer entirely, but my sense would be to move the word prominently to behind information. Just move it 2 words to the right. I don't think we prominently display. I think we display
like
things
prominent.
prominently.
I will circle and I will
But
ask
I'll
the
totally
editors.
defer.
That's above my pay grade.
Yeah, okay.
I will say that
It
there's,
might be above mine for making a suggestion.
I-
Sorry.
I will ask though and see what they think. On line 10, there's a typo. So when you see a new draft, it says scope twice. So I will clean that up next time we'll take a look at this.
Thank you.
Section 3, here is the Immunization Advisory Council. So we have the membership. Should we go through it and then talk about the additions, or would you talk about additions first?
Yeah,
Go through it?
Yeah.
Okay. So existing law is a representative of the Vermont Board of Medical Practice appointed by the governor. Subdivision 2, the executive officer of the Vermont Board of Nursing or designee. Subdivision 3, the executive officer of the Vermont Board of Pharmacy or designee. Subdivision 4, Secretary of Human Services or designee. Subdivision 5, Secretary of Education or designee. 4 and 5 look like it's new language. They've just been separated. They were an existing law. They are an existing law. Subdivision 6, State Epidemiologist or designee. Subdivision 7, Department of Health's Immunization Program Manager or designee. Subdivision 8, Practicing Pediatrician appointed by the governor. Subdivision 9, Healthcare Professional as defined in 1130 of this title, who is not otherwise represented on the council, appointed by the governor. Subdivision 10, 2 individuals who are professors, researchers, or physicians, or any combination of these individuals with expertise in infectious disease and human immunizations appointed by the governor. Subdivision 11, a family or internal medicine physician appointed by the governor. Subdivision 12, a representative of public schools, no longer independent, appointed by the governor, and any other persons deemed necessary by the commissioner.
now, the committee recommended accepting the change proposed by the Office of Professional Regulation, which I think you have a copy of.
Okay, not yet. Well, it's posted.
It's posted.
Okay,
yeah.
I'll take a look.
And essentially that was to add an APRN, a specific APRN, advanced practice RN, representative, and a pharmacist. So, and in doing that, we would eliminate number 9.
Okay.
Which was new language.
And you'd keep the Board of Pharmacy.
Yeah, so we decided that we have the 3 boards, and then we have the practicing individuals of those, professions.
Okay.
So the one question I want to pose to the members is around who appoints. We have a variety of different things in here. So some are appointed by the association themselves, some are appointed by the governor, some are designees, And it feels a little messy to me. So I'll give you, for instance, right off at number 1, 2, and 3. I'm not sure why number 1 would be different than number 2 or 3.
Agreed.
In other words, that the board appoint whoever it is that they
Right.
want to represent them.
Number one should not be, in my opinion, it shouldn't be appointed by the governor because there is a board. I think the only time you would have the governor appoint is when there is not a board,
I agree.
a group that represents.
Like number 10.
Right,
Yeah.
You wanted to say the executive officer?
Because we say or designee, I think that's fine.
I guess I'm asking, do you want it to be consistent with 2 and 3 that start off with the executive
I'm saying
officer?
yes.
Oh, sorry, and then add designee at the end. Okay,
Yes, because, yeah.
got it.
And so then I also have had, and this is more of a question for the department. Given the role of the Vermont Immunization Advisory Council, regarding the safety of immunizations and immunization schedules. So it being a primarily healthcare and medical related role, I've received a question about why the Secretary of Education is there, as well as representative from the public schools. I guessed at what previous legislatures had done that it related to recommendations for immunizations prior to entrance into schools, but that seems to be inconsistent with the purpose of this committee.
So, do you want me to answer?
If you want to identify yourself for the record, then yes.
I'm Meredith Plumpton from the immunization program at the health department. And the committee was originally formed to determine what immunizations would be required for childcare and school entry in Vermont.
Mhm.
So and they still do that. But it's combining these two efforts because it was an existing committee with some of the same members rather than asking them to join a second.
Another committee?
Yeah.
So does it say that someplace else in this law?
In the charge, it does, where are we? So page 9, line 6. And it says the duties of the council, review and make recommendations regarding the state's immunization schedule for attendance, school and childcare facilities. So that's where that requirement comes in.
Okay.
That makes sense.
You could, you could leave it as is. You could add language that says for the purposes of providing these recommendations, these individuals aren't voting members or something like that.
Oh,
What are people's thoughts? I thought it was a relevant question for the purposes that we've been talking about in the committee here in terms of the changes that are being made. They're not medical professionals, and that is who we were relying on to make a medical recommendation, a healthcare recommendation. And it would seem inappropriate unless for some reason, the Secretary of Education happened to be a physician or a healthcare professional, and likewise for a member of the public schools.
I think Katie's suggestion would help clarify that their role is for that other purpose of making recommendations for what's needed for school and childcare
Yeah.
and not for recommending just the medical part
Mhm.
of the.
So if there's a way that you can incorporate that, Katie, with relative ease
Okay.
and clarity, is that okay with people?
It seems a little cumbersome.
Yeah. Okay.
It seems a little cumbersome probably when they're actually meeting to sort of divvy up their work, but it makes sense, yeah.
Okay, so, and Katie, so that would be for the Secretary of Education and the representative from the public schools.
I'll call them their non-voting members for that purpose or something.
And organizationally, I'm not sure if maybe it'd be helpful to put them together. I don't mean in one line, but I just mean
Yeah.
like in closer proximity to each other on this list, but I'll leave that up to you. Okay, and then incorporating the OPR recommendations.
Yes, the ones we just talked about.
Yeah.
Had additional ones. Okay.
And then we would eliminate number 9.
Got
Okay. Yeah, go ahead, Doug.
As a refresher, OPR's recommendation with respect to nurses was an APR.
And did they recommend who is going to be doing the appointing?
I don't remember who that
Okay.
meeting.
I'll take a look. I can reach out to them.
And a pharmacist, yeah. Yeah, the APRN folks wanted 2 APRN representatives and we settled on 1.
Okay.
That was the difference, Doug.
So then it'll be our job to sort of, if we're concerned about odd or even numbers, we need to make sure that the voting
We'll look
members.
at it again,
Voting
yes.
Okay,
We'll look at it again. Let me see it. I've even written down numbers along the
I know,
side.
that
Okay.
helps me too.
Okay, so we clear on that section? Okay, thank you, Katie.
In subsection D, the council shall have the administrative and technical assistance of the department. E, the council shall convene at the call of the commissioner, but not less than once each year.
Oh, and before we go there, back on the funding advisory, does it say, what page is it?
so legal support.
Or it says what they have from the department assistants. It should say administrative and technical. Want to keep that consistent. It's on the top of page 5, line 3.
Do we need to assign someone else? I understood the department not wanting to have that legal assistance, but is there someone else we should designate to have that role? Or is that a figure it out?
I think it's a.
When the time comes, yeah, if
Figure it
needed,
out if
as
they need
needed.
it, yeah. Did you see where I mean, Katie, at the top, page 5? Okay.
Thank you. Okay, and then in subdivision 2, the council shall select a chair from among its members at the first meeting who shall not be the commissioner. Because the recommendations are going to the commissioner.
Sorry, now I've lost the page number. What page is that?
9.
Yep, 9,
Okay.
line 16 and 17.
Okay, great, thank you.
Okay, so we're gonna move on to the next section. So now we're moving to those 2 insurance coverage sections. And so again, these are changes that are in effect from passage through July 1, 2031. And you didn't make any changes when you walked through this the first time. So a group insurance policy shall not impose any co-payment, co-insurance, or deductible requirements for recommended immunizations as defined in 1130. And we have similar language in section 5.
Just to refresh people's memories, the insurance companies were okay with that and the Department of Financial Regulation was supportive of that.
So this is highlighted, not because you've made changes, but because your last draft didn't include this piece. This is the pharmacist and pharmacy technician authority that you heard testimony on yesterday afternoon. So this is language that's in effect on passage through July 1, 2031. And I'm guessing you maybe have some changes here now that you've heard testimony on it. But there is language in Roman numerals 7 and 8. The first one applies to patients 18 years of older, and it refers to immunizations generally. In subdivision 8.
I'm sorry.
Did I lose you?
Page 12.
Page 12.
Roman numerals 7 and 8.
Yeah, I just want committee members to make sure that you read through all of the yellow highlighted, because this is the first time you're seeing it in this bill.
Oh, sorry.
That's okay.
I can go back up.
I think that would be a good idea, Kate.
Okay. We have the language for pharmacists about prescribing. A pharmacist may prescribe in the following contexts. Then subdivision 2 outlines state protocol. In subdivision A, a pharmacist may prescribe order, or administer in a manner consistent with valid state protocols that are approved by the Commissioner of Health after consultation with the Director of Professional Regulation and the board, and the ability for public comment. And then this is what is authorized. So we have opioid antagonists, epinephrine autoinjectors, tobacco cessation products, tuberculin purified protein derivative products, self-administered hormonal contraceptives, dietary fluoride supplements.
I'm going to stop right there just for a second. So all of this that you see there is current law. Okay, so we're not recommending any changes to that. That's all current law. We're just taking it from one place that is being proposed and putting it into this bill. Okay?
And we're putting it in this bill so that we can add or adjust a couple of things that we want.
We're putting in this bill primarily because this is in the Office of Professional Regulation miscellaneous bill. And that will take some time to get through all of the process. And this bill is effective upon passage.
Yeah.
So we didn't want there to be an inconsistency between timeframes. So, and the Office of Professional Regulation was fine with that. They testified yesterday. And for now, we'll keep it in both bills. But eventually, it most likely will come out of the OPR bill.
Okay.
Thank you, Katie. Now let's get.
Yeah, thank you. So now we're on Roman numerals 7 and 8. So they're allowed to provide or administer immunizations for patients 18 years of age or older. There had been language referencing the CDC guidelines, and that language is what struck through on lines 9 through 12. I would think that we would want to say recommended immunizations as defined in 1130 here.
Just read my mind.
And where that's striking it's underlined immunizations, but it doesn't seem to strike vaccine. Was vaccine present in 7?
Yeah, I bet it was. In 30. That's it.
What line are you referring to, Doug?
Looking at line 8, it just says immunizations, which is underlined, but it doesn't have the strikeout of vaccine.
Oh, thank you.
That was right. Let me double check that. And then I'm assuming a similar change in 8, but I'm not sure if the question was asked yesterday. For 18 and over, we're not listing out specific types of immunizations, but in Roman numeral 8 for patients 5 years of age or older, we're listing out specific immunizations. Was that discussed at all?
Well, we didn't really discuss the age breakout.
Okay.
But I don't think that we should substitute our judgment for testimony that's previously been taken on this issue. So I think that we would, just be adding the change in language, but not the change in any age.
Okay. So I guess ultimately what my question is do we say recommended immunization as defined in 1130 here? I would guess not, because that's broader than these specifically called out immunizations.
Well, these specifically called out immunizations will also have recommendations. So I think that there should be a way to say for these specific immunizations as recommended. You understand what I mean?
Yeah, sort of something like in accordance with the recommendations established in 1130.
Right. So I think the modifier would come not at the beginning of that sentence, but right where it's talking about the influenza, COVID-19.
Subsequent and according, at the end of the clause. And
So I just want to make sure that members understand what this is doing. So in previous action of the General Assembly, when pharmacists were allowed to provide immunizations, vaccines, there was a policy decision made that it would be for patients 5 years of age and older. In other words, those that are younger than that would continue to get that through their primary care, their pediatrician, other healthcare professionals, not pharmacists. So that's what that is doing, and we're keeping that. So that's what this whole conversation is about.
Okay.
People understanding that? Have a
Yeah.
question? Okay. So in the original legislation that allowed pharmacists to give vaccines, there was a decision made that they would only do that for children who are 5 years of age and older. So that if you are younger than that, you still have to go to your pediatrician or other primary care. And we're not changing that.
I remember that.
So we're not,
Okay,
so we're not changing that.
okay,
And that was part of the conversation that Katie and I were having.
okay.
What Katie is going to figure out how to do is, in the bill that we're talking about now, the panel will be making recommendations to the commissioner about the influenza and the COVID-19. And, so that the modifier needs to be in there somehow, as referenced in the previous section that we've already talked about. So she's going to work on that and we'll see it in a different draft.
So I think what I'll put at the end before the semicolon is consistent with the recommendations established in accordance with 1130A. So that's the new language.
Okay, and we'll ask the department to make sure that that is representing what we think it is, okay?
And 1130A
Yeah, go ahead, in this bill.
is that the broader recommended immunizations, or is that limited to standing orders and influenza, COVID-19?
That's the process by which all of the recommended immunizations. But why I think it should be 1130A is because that subsection A talks about dosage and timeframes. So we're saying in accordance with that, even though we're not pulling in the term recommended immunizations to mean all immunizations on the schedule.
Okay.
Okay. So I'm moving to the next section, which is pharmacy technicians. This is also in Title 26. The existing language is that pharmacy technicians shall only administer immunizations. We have language to patients 18 years of age or older as established in the previous section that we just looked at of this title and the resulting state protocol. To patients 5 years of age or older, influenza immunization, COVID-19 immunization, and subsequent formulations or combination products thereof in accordance with the previous section that we just looked at and the resulting state protocol.
So that means there will be it's a little bit of a complicated avenue, but it means that it references the one we were just talking about. And in that one, it will be referencing back to the dosage requirements and timing and all of that. So we don't repeat it here again. Like that's, in case you're wondering, that's why. Okay.
And then in subdivision 3, this language currently references that the immunizations have to be in accordance with the CDC schedule. So that language is being struck. And then we're renumbering. So what is currently 4 becomes 3. And then subsection D is eliminated, current subsection D, which is that pharmacy technicians shall administer only those immunizations that are recommended by the CDC's Advisory Committee on Immunization Practices, and licensed pharmacists are permitted to administer under state clinical pharmacy protocol as established in the previous section. So that language would be eliminated. I just want to take one more look at this. Yeah. Okay.
Yeah, just for my clarity, line 6, that statute there, is that the one that describes what you were describing earlier, that for clients under five or under?
It's on the previous page.
It's on
Page 12.
Line 13.
line 13. That, I see that, but I'm wondering about, so I guess 5 or younger. What, I'm just,
Since they're only allowed to for 5 or older.
right, pharmacists, right, yes.
Right.
But this 23B, I'm just wondering about people who aren't reading it all, like probably me, and wondering, well, then where do I go if I have a child who's under 5 years old? Where do I go to get the clarity for that? And I wonder if that's this 23
No, 20, I just want on line 6, that
Yes.
very thing right there is, if you look on page 12, it's
Yes.
lines 13 through 15. Okay, so, if the law stays silent on where you go, if it's, you follow your normal course of action, you go to a pediatrician or your primary care.
I see,
This
okay.
is all, this statute is only saying what pharmacists and pharmacy techs are allowed to do,
Okay,
not what they're not allowed to do. You see what I mean?
yes, I understand that. I do understand that.
It's not meant as a public information document.
Correct, there we go.
Okay.
So that brings us sort of to the end of what is happening on passage. And now on page 14, line 7, this is where we start putting language back in as of July 1, 2031. So as of that date, we start going back to what is the current status quo in terms of language. So the first heading on line 7 is restoring current immunization recommendations on July 1, 2031. So that puts section 1130 back as it currently is.
People understand what we're doing here? Okay.
And on section 9, so let's see where I am, page 18, section 9, 1131. So this is the Immunization Advisory Council. This goes back to as it currently is. You will notice that we skipped a section, the new language that is 1130A. That's because that's new language and it's easy to just sunset it, which we don't have the ability to do if we want to go back to something that was previously there. So we will deal with the sunset at the end of this document, but that is why we've leaped over it.
So, it's gonna make life complicated, no doubt. I'm not sure we want to sunset the membership of the
I
advisory
agree.
council.
You're not. Oh, no, you're not. Are you?
Yeah, it looks that way.
No.
The
We'll
original,
go back.
it goes back to what it is.
And I'm wondering if you're saying you
No.
don't want to sunset the changes that we're making.
Correct.
1130A is what is being sunset, and that does not have an advisory council or committee in it. What you are doing is 1131, which is listed on the Immunization Advisory Council. You're going back to as it currently is. If it's your choice to retain the changes you've just made moving forward,
Yes.
we could do that. because
Yes, that's what
it's language. Okay.
Yes.
So you want to retain do you want to retain all of the changes in that section?
In the
No,
membership.
you don't, because you want to get rid of the reference to recommended immunizations.
We want to retain all of the membership changes.
Got it.
As well as
I
the
can see that.
language that we are adding about the Secretary of Education and public school official.
I don't think you want
You
to
don't.
retain that because
Okay.
recommended immunization as a concept and as a charge for that committee will go away.
Will go away.
Yeah,
Okay.
but I can retain the membership of the group.
Okay, we want to retain the membership.
Okay, let me put a note for myself before I lose that.
And in the funding, so that's the membership of the advisory council, the funding advisory council. I would want to maintain the changes that we made there.
Okay.
So for instance, just an FYI for people, like the Blueprint for Health doesn't need that, 2 levels of nomination in order to get on this group. That might make the bill a little bit shorter. Because we don't need to put this back in.
You'll have to well, I could put stars there, so yeah. It might make it a little bit shorter. But you will need to show some of the other sections.
Yeah. Okay,
Okay, I'll keep moving.
okay.
Um,
And I'm sorry, just to interrupt for a moment. I just want, in case people have not looked at their agenda, the updated agenda, we are going to be hearing from Dr. Hildebrandt at 10:30. Just to answer any outstanding questions that we may have as a result of the testimony that we have received during the course of taking public testimony on this bill. Okay, since he was the very first witness, we felt we needed to hear from him again. Okay. Yes, go ahead.
Related to changes for making and going back to original language, it includes shifting from recommended immunizations back to vaccines. But didn't we have discussion about the use of the word immunization and how it was helpful to have that, even if we don't use recommended immunization? There was some value in using immunizations rather than vaccines.
It's a little broader and it's.
So I don't know what role that plays in these changes, but we're reverting a little too far back. by
Yeah.
going To vaccines, I think, if I followed our earlier discussion correctly, because immunizations is broader than, maybe broader than traditional vaccines.
Okay.
We want to retain that change.
Yeah, I'm hearing what people say. I'm just trying to think about how Katie's going to represent that.
I can do it.
If anyone can do it, it's Katie.
But we will need more than just my eyes on it when we look at it again. So I think what I would do is we would just go back to the term immunizations instead of recommended immunizations. I would keep the phrasing that the health department gave us about,
Definition.
right.
Yeah.
And then everywhere where we had switched from vaccine to immunization, to recommended immunization, I would move to just immunization. So I think that's doable.
That's, sounds right.
In
Let's see what it looks like in print.
Yeah, I know.
French.
Okay, so I'm gonna skip through that. I'm on page 20. So now we're restoring current insurance coverage for immunizations on July 1, 2031. So this is the two sections on the group policies and individual policies. So this goes back to the term immunizations. That was the phrase that's used in current law. We get rid of the reference to recommended immunizations and we revert to the existing language, which references the CDC.
Okay.
Same thing in the next section. Where we get rid of reference to recommended immunization, you retain what is in current law around CDC. And then page 22, we restore the current pharmacist and pharmacy technician authority on July 1, 2031. So this language, this is what we just looked at with regard to the pharmacists. This goes back to as it currently appears. And I think that you're right, that should be vaccines. Let me double check that, page 20.
I'm about line 6 on page 23.
Yeah, I just want to see what it says in current law. Okay. Yeah, and otherwise it goes back to how it appears now.
Oh, I know why it doesn't say it there. Because it's just a construct of the sentence.
Oh, yeah, you're right. Yep. Yeah, vaccinations.
See
Okay,
how it reads? It's just the construct of the sentence.
okay. Pharmacy technicians,
Revert back, same thing.
same thing, we're reverting back to how it looks right now. And then, section 14, page 25.
Can I ask a question?
Mhm.
So I believe that we just made a decision to keep the new definition of immunizations and the language that the department provided.
Mhm.
And so wouldn't we want this to be consistent with that?
Moving forward.
Yes.
Well, it would no longer. How so? Because this, I think this could probably stand on its own as it does now, because currently it doesn't refer.
And
to
it's,
Title
and it's all
18.
going back to CDC.
Yeah.
Okay, which is what, this is the language is used there. Okay, all right. I guess they needed to say out loud what I was.
Yeah.
I understand what you're saying.
It's legislative gymnastics. That's a little bit to like wrap your mind around.
I like that.
that.
A challenge to the editing department, that's for sure.
Yeah. They were very patient. Okay, page 25, section 14. So this is the repeal that I mentioned before, because it's all new language. We don't have to do anything or revert back to anything. We can just get rid of it after a certain date. So we can take care of that in one sentence where we're just getting rid of that whole section on a particular date.
And Katie, I just want to make sure I'm referring people to the right pages so that they know exactly what's being repeated, committee members. So 1130A starts halfway down on page 1 and goes to near the bottom of page 5. Is that correct?
No, it is
Okay.
section 2 of the bill, so it starts on page 5, the bottom of page 5. And it goes to the bottom of page 7,
Okay.
so that goes away.
Oh, yes, I was looking, okay. I was looking at funding, sorry. I was looking at funding. Okay, so I want to make sure that people are understanding what that very last, that very last sentence in the bill is saying. So, or next to last. So on lines 6, 7, and 8 on page 25. So you know exactly what's being repealed. Look at what Katie just said. It starts on the bottom of page 5 and goes to where, Katie?
Bottom of page 7.
Bottom of page 7. Okay, that is what's being repealed. Reverting back to original, okay?
Well, there's no.
That's eliminated. There's no, it'll go away. It'll go away. Yeah. You look like you wanted to,
No, I was gonna jump in and just say something about effective dates.
oh, go ahead.
So the effective dates are important, obviously, because we're sunsetting things. I would just encourage more than just my eyes on this. So we have that sections 1 through 7, and section 14 and the effective date section are all taking effect on passage. And then, sections 8 through 13, those are all the sections where we're going back to something on July 1, 2031. Those are taking effect July 1, 2031. So I just wanted to be clear what that is doing.
Okay. So that was a lot. And we'll get another version of this and we'll have another, walkthrough. And I appreciate, Katie, all the work you did and all the drafting gymnastics, like you said, for sure, involved with this, but trying to, represent the conversation, also trying to understand, that people want to see it go back and really have another, whoever's in the legislature at that time, look at this again after some period of time, which is we're choosing as July 1, 31. Okay. All right. So we're going to shift. Do we have not yet? Okay. Dr. Hildebrandt is okay. Ann, you got a question? Go ahead. I couldn't see you before if you had your hand raised.
Right.
I'm sorry.
No, I just put it up here. I just wanted to reference the language about vaccine versus immunization, which came up when I was there last, and I was concerned about confusion, or did that expand it? And so I really appreciate the language that came back, I guess, from the Department of Health, that's now in there. I think that really creates the clarity, that it's not some wide open door, that it's still specific to what all of our intent is. So I think that was great. That had been a little nit that I was concerned about. So
Great. Thanks, Ann. Okay, so momentarily we'll be joined by Dr. Hildebrandt, so stay tuned. Let's just mute the room for a moment. Let's just stay online.
Just fast. Say if people listen on
Okay, for a moment.
It's not important.
Okay, while we wait for the Commissioner of Health